Hello, everyone. Welcome to the Alliance to Save Our Antibiotics webinar, Farm Antibiotic Use and Husbandry, Better Understanding Through Data. Thank you so much for joining us for this very interesting event. It will run until 3:30 p.m. My name is Kath Dalmeny and I'll be the chair today. I'm the Chief Executive of Sustain, the Alliance for Better Food and Farming, and a member of the steering group for the Alliance to Save Our Antibiotics, along with colleagues from the other co-founding organisations, Compassion in World Farming and the Soil Association. The Alliance to Save Our Antibiotics, I thought I should start by just letting you know a little bit about what we are. It's an alliance that brings together over 60 organisations who work on a wide range of issues: farming, human health, antimicrobial resistance, AMR, animal welfare, the environment, food standards, a whole range of things. And why we come together is to press for recognition of and action on the role of livestock farming in driving the profligate use of antibiotics, which in turn contributes to the alarming rise of antimicrobial resistance worldwide. And our view is worldwide, but also in the UK. So that's us. What about you as an audience? Sometimes it feels like we're quite invisible in this online world, but I think it's very important for you to know something about who's with you at this webinar. There are over 100 people attending, and we'd like you to feel welcome and appreciated, because you really are. Looking at the registration details, just under half of you perhaps have veterinary backgrounds or are involved in veterinary regulation or are studying veterinary science in the UK or perhaps internationally. A special welcome to colleagues who are joining us from Portugal and the Côte d'Ivoire. Just under half of you are from non-governmental organisations across that wide range of interests within our alliance, so farming, health, AMR, animal welfare, environment, food issues. And the rest of you, as far as I can tell, are from the food, farming and pharmaceutical industries. And once again, I say everybody is very welcome. So your questions and views are important to us as we go through. So before we get started, I'd like to just go through a few things so you know how to participate in today's event and also how to keep in touch longer term. So the first thing to say is that we're recording this webinar and we'll share the link afterwards. Second, please do get onto our mailing list for the Alliance to Save Our Antibiotics. We don't spam people. A link will be circulated. It's a way to keep in touch. It's a way to get involved with the important work that the Alliance does. Third, if you're a social media type, we're tweeting today with the hashtag organic data, as you'll see at the bottom right-hand side of the slide. And the @ symbol shows you our tweet handle. Gosh, I do sound so modern. So please do join in with that online social media conversation either during or after the event. And fourth, because I do see this as an ongoing conversation, not just today's webinar. And fourthly, importantly for today, I want you to get familiar with the control panel that's probably at the top right of your screen. So that's the control panel for this software that we're using for the webinar. You may have joined the presentation using your computer's speaker system by default. If you'd prefer to join by telephone, then you select the phone call in the audio panel in that control panel that you're seeing on your screen. And the dial-in information will be displayed. Through that control panel, you can also access the handout for this webinar, which is a one-page summary of the research and key findings. And in that panel, you're also able to submit questions which will be able to be put to the panel towards the end of this session. So this event follows a traditional format of presentations and then that question and answer session at the end with a panel of all our speakers. So you can ask questions either by typing them into the questions pane of the control panel at any time during the event, or we may have a system for being able to raise your electronic hand as well, although we'll see how that goes depending on how many questions we get. Behind the scenes, the coordinator of the Alliance to Save Our Antibiotics, Susie Shingler, marvellous woman, is working away. She'll be sorting your questions into priorities and common themes for me to bring to the panel later. So I'll keep reminding you throughout the session to put your questions and comments in there, because we'll be covering a lot of ground. And it would be helpful if you can say where you're from when you submit or ask your questions. And if we run out of time to answer those questions during the session, we'll do our very best to respond to you after the webinar, because this is an ongoing conversation. So, to business. Today, we're unveiling the results of a really worthwhile project, which has been in the works for several years. We've been looking at the role of farming practices, and especially animal husbandry techniques, in reducing the need for and overall use of farm antibiotics. And our brilliant speakers will be explaining the detail of that. So it is my great pleasure to introduce first our first brilliant speaker, and she really is brilliant. Such a pleasure to get a chance to hear from you, Helen. Helen Browning is Chief Executive of the Soil Association. She's also an organic livestock and arable farmer in Wiltshire and a great champion of higher welfare livestock systems. Helen, please do take the virtual floor. I shall go off cam, but I'll be able to, if you need me to do anything, just say so.
Thanks, Kath, and real pleasure to be with you all this afternoon. Yeah, I'm Helen Browning, and the Soil Association has had an interest in this topic for many decades, actually. We've been campaigning on the reduction of antibiotics in livestock farming for over 25 years, in recent years as part of the Alliance. But we published 7 reports, actually, through the great auspices of people like Richard Young and Colin Noonan, who you're going to be hearing from today. And yet, despite that long interest in antibiotics and really tracking and trying to highlight some of the dangers of the routes we were going down, we did struggle ourselves to get reliable data from our own farms. And some of the work we were doing through things like Innovative Farmers, where we were trialing ways of reducing antibiotic use using other husbandry methods, was showing us that there was quite a lot of variability amongst our farmers, and that seemed to be related to their confidence and knowledge about what was working well. There was a real need to continue to not be complacent about our own antibiotic use on some farms. So the results today, which Ed will take you through properly in a moment, it does confirm that there is a considerable range in use. And although the sample size isn't as large as we'd liked, it does give us confidence that organic techniques are leading to a much lower than industry average usage of antibiotics. Now, at the Soil Association, I think everybody here, our interest here is in animal husbandry and welfare, as well as in antibiotics. It's vital to reduce antibiotic use as an issue in its own right, but we feel it's really important to be trying to make the case that animal welfare and the reduction of antibiotic use go hand in hand. Indeed, actually, I believe that the only way that we're going to get to ultra low use is through more extensive high welfare systems that are well managed, and the management of those systems is paramount. It's not enough just to be more extensive, you've got to manage those systems well. And we also know that a lot of vets have concerns when we're looking to reduce antibiotic use, that's going to lead to welfare challenges. And therefore, we do need a really good evidence base to support and give confidence to both vets and farmers that reducing antibiotics and high welfare outcomes do go together. So we do need to be monitoring welfare outcomes, both the positive experience that our farm animals have, as well as avoiding the negatives like lameness and mastitis, alongside antibiotic resistance and reduction. And we're going to be aiming to do that even more in the future, resource permitting, including as part of a new initiative that we're launching called Soil Association Exchange, which will be looking at data and metrics across the piece from our farms, but very much including animal welfare outcomes and antibiotic use. Now, as a farmer myself, I found it quite challenging, particularly with my staff when I first went organic about 35 years ago. I think the one thing that really worried my herdsmen was the idea of moving away from dry cow therapy. At that time, that felt quite a bold move. We were all told that dry cow therapy had to be used on all cows every year. And so again, it did seem that it was about confidence that we needed to build. We started off by just not doing the ones that didn't seem to have too many problems, and over the first 2 or 3 years built our confidence. And I think it's the same as we look at moving now as a farm here into produced without antibiotics, PWAB, as part of our OMSCO membership. Where that move to no antibiotics again feels deeply challenging, and we need to be learning as we go, building our confidence and making sure that we are getting this right in terms of welfare. With my pigs, it was a slightly different story because we built that system from scratch, and we learned as we went and adjusted the system quite a lot in the first 10 years to ensure that we didn't need to use antibiotics except in really exceptional circumstances. And some of the things that were really important there were clearly late weaning, frequent moving onto clean ground, the appropriate use of vaccines, and keeping the stress levels really low. So I do see low antibiotic use as a real co-benefit of the move to organic. And another really good example of why policymakers need to look at the whole system as we move into the new post-EU, post-CAP policy environment. We need to be encouraging policymakers to be supporting whole system approaches like organic, which have those benefits like reduced antibiotic use as part of the package, rather than just looking at sort of a bit of habitat creation here or a bit of greening at the margins. At the Soil Association, we're keen to see whole systems approaches which bring all those co-benefits with them. And finally, I'd just like to urge all certifiers to get involved in this data collection project. This sample size is smaller than we'd like. We need a much more comprehensive data set to give real confidence and to be actually learning and exploring, as I say, what's working well at the farm level, to share that knowledge between farmers, to share that knowledge outside of the organic movement with the wider farming community, because this is a challenge that we all need to tackle together, and we all have a lot to learn about how to do it really well. So the more people who can join in the next phase of this work, the better. Thank you very much, Kath, and I'll hand over to you and Ed to take us through the details of the report.
That is absolutely fantastic. Thank you for that introduction, Helen. And as you said, let me now introduce Ed Bailey, who has been the lead for the Organic Data Project. He's a vet with the George Veterinary Group and works closely with the Soil Association. And Ed will explain how the project worked, what he found. Ed, you've got 20 minutes, and I'll give you a time check when you've got 5 minutes and then 1 minute left, if that's all right with you.
Okay, thank you. Right, thank you, Helen, for introducing the project. I'm just going to talk a bit about how the project was conducted and what we think we've learned from the process. So initially, a letter was sent from Helen out to all licensees explaining why we wanted to do the project and requesting their participation. In the letter, the background was given that huge progress has been made by the farming industry in reducing antibiotic use by 48% since 2014. But still, approximately a quarter of total antibiotic use in the UK is still in farmed animals, as can be seen in this infographic from the Responsible Use of Medicines in Agriculture Alliance. It was explained that this was a one-off means of collecting data for the project, which would be followed up by the Soil Association collecting annual inspection in future. We wanted to get a single data set over a fixed period of time that was easy to analyze as a baseline from which we could start. Accurate usage data is really difficult to obtain because on farms, farmers will enter on an animal by animal basis using all sorts of different systems, and it's very, very difficult to extract that information. Sales data is much easier to collect and analyze. So consent was requested to contact vet practices and obtain antibiotic sales data for each client. Consent was also requested to process the data and share with the Soil Association and the Alliance to Save Our Antibiotics for the purposes of this study. Accurate livestock numbers were also requested by age category so that we could convert those antibiotic sales numbers into usage per animal farmed. The response was reasonable. We had 211 farms which contributed data, hopefully you can see on the slide the livestock numbers that featured in our data set. We had a reasonably good coverage of cattle and sheep farms and a much smaller sample of pig and poultry farms. Unfortunately, no true national picture is available until industry organisations have implemented plans for compulsory electronic medicines books to capture accurate usage. This has started in the pigs sector already, but is yet to be implemented for ruminants. There is a national data set available through the UK Veterinary Antibiotic Resistance Sales and Surveillance, and they have published a 2020 report which represents a third of dairy farms and 10% of slaughter cattle with no data collected for sheep. And though our sample size is small, it could be said that it's similar in proportion of Soil Association accredited stock to that of the UK stock represented by the UK VARS survey. And as with UK VARS, contribution was voluntary, so may not be truly representative. Ongoing data collection will be more accurate, as it will be a requirement for all licensees. So not only will we get more farmers contributing, but nobody will be missed off. So how is the data analysed? Livestock numbers provided by the farmers are used to estimate a population corrected unit on each farm. Now, this is an EU standard methodology to ensure that all published figures are comparable. And there are many idiosyncrasies to this, including fixed weights based on age, which may not reflect some breeds or production systems, and in beef only includes cattle sold or slaughtered, which for example, systems like conservation grazing, where you have a large number of adult cattle which may not be sold or slaughtered for many years, wouldn't be contributing to the treated population. And here you can see in the slide that the AHDB calculator, which is freely available, was used to convert the sales data and the livestock numbers into a total milligrams per population corrected unit in the herd, with a breakdown available for each farm on which medicines had contributed to that figure. So what did the data show? As you can see from the table or the graph, whichever you find easier, striking differences can be seen in every different sector, with pigs being the most marked and dairy the least. But even in the dairy sector, the average usage was less than half that of the UK VARS figure for 2020. And the significance of that is that as the picking of low-hanging fruit, which led to such rapid progress in reducing usage across the industry, is no longer available, further reductions will become more difficult. And that can be evidenced by a slight increase in the milligrams sold between 2018 and 2019. We hope that organic farming practices may offer some ideas for the wider industry for continued progress on antibiotic reduction. As with most benchmarking studies, a wide range of results is seen. Benchmarking is really useful because it's an opportunity for producers to compare themselves with their peers. And we also want to ask, what can the highest users learn from the lowest users? That's something that hopefully the Soil Association can facilitate. Farm size was not an important factor, with large and small farms at both ends of the scale. So we wanted to ask, what factors do contribute to this range in use? Are they human factors, system factors, particular diseases? We reported the results of the survey to all of the farmers and to the vets which had contributed data so that they could reflect upon their own usage. But we also wanted to follow this up with some more detailed information. And we decided that the way to approach this would be a semi-structured interview based on published literature, and that we would try to target the highest and lowest users in each sector with a telephone interview to see if we could learn a little bit more from their experiences. We managed a reasonable number of farmers to get to contribute to this. We had 22 higher users and 15 lower users in cattle and sheep, and with pigs, we spoke to 2 farmers, both of whom were low users. Didn't speak to any poultry farmers. Most of those were in 0 usage. The first, and possibly one of the most striking conclusions from the interviews, was that everyone thought that they were a low user of antibiotics, irrespective of their position in the benchmarking range. Remember, in the range that we just saw, there were some people who were 0 users and some people who were well above the UK average. This agrees with much commonly received wisdom, such as that people think that they are a better than average driver. So the psychology around antibiotic use and behavioural change is really complicated and something that we need to understand better if we're to make further progress with antibiotic use reduction. Second most striking conclusion was that an individual trusted vet was the single most important source of advice for medicines and health, and that applied whether they were high users or low users of antibiotics. This agrees with several published papers on the subject. An opportunity exists for vets who work with farmers and achieve high levels of welfare and low levels of antibiotic usage to share that knowledge successfully from a position of influence. The Soil Association plans to work more closely with vets to improve knowledge transfer. It is, however, also potentially a barrier to change. In another study on use in sheep, 21% of the variation in antibiotic use between farms was accounted for by the vet practice. So the attitudes of the prescribing vets can be a force for good or a force for bad. There were 3 diseases which were overwhelmingly named as responsible for antibiotic use. Lameness being the most common, then mastitis, then respiratory disease. And that was the case across all of the sectors except poultry. There are existing industry control programs available for these: the AHDB Healthy Feet Program, AHDB Mastitis Control Plan, the Sheep 5-point Lameness Plan, and Colostrum is Gold. We need to help higher users engage with national programs and also with peer-to-peer learning, such as Helen has described, with discussion groups, innovative farmers, and Soil Association field labs. Next, we wanted to speak to farmers about what husbandry factors they felt were important in their levels of usage. And if we look at this by sector, we can see that the most commonly named factor for dairy was a clean environment, followed by minimal time housed. Other aspects which were named frequently were breeding specifically for health traits rather than production, good cow tracks, regular foot bathing, and prompt identification and treatment. Higher users tended to name risk factors more specific for mastitis and to health around calving as being more important, such as parlour routine, good transition cow health, low stocking rate, and making cows stand after milking to give time for teat end closure. Other measures mentioned by individuals as being important were lower yields, block calving, investment in housing or parlour, routine foot trimming, fly control, and higher culling. In beef and sheep, the commonest factors mentioned were a low stocking rate and calving or lambing outside. Also, minimal time housed, good stockmanship, low stress handling, and good nutrition were commonly mentioned. Also raised were the use of the 5-point plan for sheep lameness, gathering and handling stock in different locations where possible, a compact lambing or calving period, foot bathing, breeding policy, ventilation, a closed herd or flock status, the mineral or trace element status, and outdoor loafing provision during the house period. In pigs, remember, we only interviewed 2 farmers, so a much more narrow range of opinions was expressed. But both these farmers mentioned prompt identification and treatment, later weaning dates, the avoiding of mixing groups, and as Helen explained, clean ground, so integration with an arable operation where pigs are constantly moving onto ground that has been well rested from the pig production system. Next, non-antibiotic approaches to treatment were inquired about, and the use of vaccines, anti-inflammatory pain-relieving drugs, and topical antiseptics or liniments was already widespread. It seems that further reductions are more likely to come from changes to husbandry practices rather than antibiotic replacement. And an important factor to consider here is that we must be careful about the temptation to offer solutions in a bottle. This has been the case with, for example, respiratory disease vaccines or sometimes with nutraceuticals, where possibly, perhaps if you stop using antibiotics but use this instead, you can continue doing as you were before. That's rarely the solution. Normally, there's a need for system change rather than simply substituting antibiotic with another product. Next, we inquired about the significance of health plans and the organic standards, and it was noticeable here that paperwork-based approaches were unpopular. There was a preference for regular discussion with the vet on topical issues, with low users in particular also mentioning the benefit of discussion groups. Some farmers found regular health plan review helpful, and very low users tended to refer more frequently to the standards as being a helpful reminder of what is permissible, possibly because they were treating animals so infrequently that it was difficult to remember. The opinion of health plans as a hoop to jump through rather than as a vitally important tool is a major barrier to change by this route, and something that we need to consider in our approach to further reducing antibiotic use across the sector. Opinion of online resources was divided. Some found them very beneficial, fitting in well to busy lives. Others found the choice available overwhelming and the format insufficiently engaging. Practical medicines training was discussed. It's now required by farm assurance, and so as many of the people who contributed to the survey were farm assured, they had experience with these courses. They received very positive feedback, with a common comment being that younger vets being more open to non-antibiotic approaches. OMSCO, which is the Organic Milk Suppliers Cooperative, are looking to increase the amount of milk that they can market as produced without antibiotics, or PWAB, which is eligible for global organic markets, where the standards may be slightly different from those in the UK or the EU. To be certified as PWAB, cows in the herd can't have been treated with antibiotics. Where antibiotics are required for welfare reasons, the cow must be kept separately and sold or culled following recovery or used to suckle calves. Animals may be treated as calves, but not less than 12 months before entering the herd. There is a strong incentive to avoid antibiotic treatment unless necessary for welfare reasons, which in turn incentivizes minimizing the occurrence of disease rather than relying on treatment. This leads to the challenge of quite a lot of received wisdom and the need to approach antibiotic use and the importance of health and welfare in leading its reduction with an open mind. And here, the farmer and vet can really learn from each other. Practices to achieve this low usage may be more widely applicable, such as increased footbathing and investment in tracks or gateways for fowl, the reduced usage of intramammary antibiotic tubes for mastitis, or outwintering strategies to minimize the house period. By furthering these, we may reduce antibiotic use to negligible levels through high levels of welfare. So what are the next steps for the Soil Association? The first is we need wider participation. We need to be able to keep track of trends within organic to remain at the forefront of responsible antibiotic usage. And we need to share those success factors with the wider industry. So antibiotic data will be collected as part of annual inspection. Usage will be viewed alongside health data, especially lameness, mastitis, and culling, to ensure that low usage goes alongside high welfare and not the reverse, as is commonly a concern. Long-term trends will be identified. For example, were high users just having a really bad year? Or, as in other countries, for example, data from the Netherlands, do we see a trend for persistently high users who may benefit from extra support? Also, increased engagement with vets for mutual understanding and also to ensure that producers benefit maximally from this trusted source of advice.
Ed, just to let you know, you've got 5 minutes left.
Okay, thank you. The Responsible Use of Medicines in Agriculture Alliance, RUMA, has a targets task force. They set the targets back in 2014 for antibiotic reduction in the sector and have really driven the agenda there very successfully. They've set some targets now for 2024, and these include data collection being improved, as we previously discussed, and also bespoke health plans. On the slide here, I've displayed what I believe are the critical factors based on the responses in this survey. If many farmers find data input collection and paper health plans primarily to be an extra burden, then we're unlikely to make progress in that direction. If, however, we focus on areas that farmers respond well to, then it's easier. Improving communication skills of vets, both in practice and as students, and attitudes to prescribing will have a major influence on the likelihood of success in achieving these targets. So if we can have a look through what's been suggested here, creating a network of farm vet champions, there should be champions within each farm animal-based practice in the UK with a real interest in driving this agenda of reducing antibiotic usage. For those champions to be successful, they will need specific training on behavioural change, for example, using motivational interviewing, and increased uptake of medicine's best practice training among farmers. But we've already seen that the feedback from that is very positive. That should be an easy win. Also, the increased uptake of medicine's best practice training amongst students, both veterinary and in agriculture, is a great place to look, because young people have a tendency to be slightly more open-minded. They tend to embrace technology more quickly and new ideas. We've still got a long way to go. For example, the 2020 baseline for oral antibiotic doses per lamb in the UK was over 7 million, which would actually equate to nearly 1 per lamb in England. So I'd just like to talk briefly now about the sort of models involved here. And there are lots of comparisons with COVID in terms of behavioural psychology. So there's a perceived susceptibility. How likely are you to become infected with coronavirus? Perceived severity. Is it going to kill you? What are the benefits of a behaviour to avoid getting infected? And what are the barriers to adopting that behaviour? Those will feed into the belief that either there's a real threat from COVID or that there is not, and the belief that changing your behavioural patterns, for example, social distancing or wearing a mask, will be worthwhile and to have a real effect. Those will then feed into whether or not you adopt that preventive behaviour. The same thing happens with antibiotic usage. You know, is there a perceived threat from using antibiotics? Is it something that you're worried about? What are the benefits from reducing usage, and what are the barriers? And things like the PWAB contract can really alter this. So suddenly there's enormous benefit, an incentive from not using antibiotics, and the barriers to stopping using it, the fear that things will go wrong, are suddenly reduced. The alteration in the balance of those things can therefore have a strong influence on the preventive behaviour. So within this, the PWAB experience has been a good example of how vets don't have all the answers. We will make the best progress if we're open-minded and learn from each other, placing health and welfare and a life worth living at the centre of farming practice to drive down the need for antibiotics in farming. And the message really for vets would be that that is through partnership. And again, through this same study on the communication role in improving udder health in the Netherlands, the conclusions were that when farmers do not believe in the solution offered, the problem itself is less relevant. When farmers don't think they have a problem, the solution offered is not relevant. We need to know what farmers are thinking and how they wish to approach change in order to best achieve that change. And the message to farmers is that practical solutions to further reducing antibiotic use are already proven. The low users in each of these antibiotic use data sets are showing that it can be done, and that high levels of welfare, profitability, and low antibiotic use can all go hand in hand. Changes in systems and mindset are often more effective than complicated protocols. For example, tight lambing or calving patterns to minimize pathogen buildup, maximizing time at pasture for efficiency of grass utilization, later weaning in piglets, frequently rotated accommodation outside alternated with arable, and realistic expectation of cure rates and treatment success. Often, a relatively small proportion of the herd or flock represents a big part of the problem. In summary, the national progress on reducing antibiotic use in farm animals has slowed, and lessons can be learned from practices in the organic sector as a guide to drive down antibiotic use. Many of these aims are shared by the Rumour Targets Task Force goals for 2024 and partnership between vets and farmers to improve communication and facilitating peer-to-peer learning, key areas to focus on the Soil Association in continuing to be at the forefront of low antibiotic use in the UK. Thank you.
Ed, thank you so much. What a wonderfully clear and compelling presentation you've just given. There is one question that's come in from a member of the audience that seems to be very specific to you. and I might ask it now if that's all right with you, because you've been so timely as well. Were dairy calf numbers collected and used? Asks Lisa Morgans.
Because dairy calves are not part of the population corrected unit on dairy farms, then although the numbers of dairy calves were collected as part of the study, then they are effectively disregarded for creating this treated population on a dairy farm. So if that farm was also producing beef and selling beef calves, then it would have been looked at under beef. But for dairy, then all of the usage on the dairy farm is borne by the adult milking cows.
That is very helpful. Thank you. And we may come back to issues like that in the panel session. Once again, I shall remind the audience that your questions are coming in, and it's very helpful to see those because we'll be able to steer the panel discussion later. So thank you very much, Ed. If you want to go off camera now, I shall invite Colin to take the virtual floor. And Colin Noonan is the scientific advisor to the Alliance to Save Our Antibiotics. He's been working in this sector for 20 years and more. And I'd say he's been one of the main driving forces in the long campaign to get the role of farm antibiotic use recognised as an area of major concern. So Colleen, you have 20 minutes and I'll give you a time check when you've got 5 minutes and then 1 minute left.
Thank you very much, Kath. So I'd like to talk about where we are with farm antibiotic use, in particular in the UK, and the reductions that have occurred, and about what might need to be done if we are to see further significant reductions occurring in years to come, learning notably from organic farming, but also from some non-organic higher welfare farming. So, whoops, sorry. So globally, globally, approximately 73% of antibiotics are used in animals rather than in humans, whereas in the UK the percentages are more or less reversed, in that approximately 30% of antibiotics are used in animals and about 70% are used in humans. And this is partly due to the reductions that we've seen in farm antibiotic use in the UK in recent years. However, scientists are warning that despite the huge use of antibiotics in farm animals globally, that we may see further increases of up to perhaps 50% between 2013 and 2030 if we continue with business as usual. And business as usual essentially means more meat production and the further intensification of farming. Fortunately, we are starting to see action both in the UK and in Europe and in some other countries as well. So in Europe in particular, Europe is going to be introducing new veterinary medicines regulation, which will come into force in January of next year. And this is very welcome in our view, as it will ban all routine antibiotic treatments of farm animals, including all preventative group treatments. Unfortunately, so far, the UK government does not support a ban on group prevention, but it does say that it will consult with stakeholders before deciding on what action to take on preventative antibiotic use. Now, despite not committing yet to a ban on group prevention, we have seen some quite significant reductions in veterinary antibiotic use in the UK in recent years. Since 2014, we've seen a 48% reduction by 2019, although there was a 3% increase in 2019, partly due to some increased disease incidence in the pig industry, where some significant cuts in antibiotic use had occurred in previous years, and similarly in poultry, we've seen some very large cuts in antibiotic use. So how have these cuts been achieved? So first of all, the farming and veterinary industries have essentially accepted the conclusions of a government review, the O'Neill review, which called for large reductions in global farm antibiotic use. The pig and poultry industry actually voluntarily began collecting data on their own usage and publishing this data on their antibiotic use. And this enabled individual pig and poultry farmers to compare their usage with their own sector. And if they were high users, it motivated them to cut their use. As Ed has been telling us, there has also been new industry targets that were introduced by the industry organization, the Industry Alliance, the RUMA Alliance, and RUMA also introduced a new guidelines for antibiotic use, which discouraged routine antibiotic use. The poultry industry specifically ended all preventative antibiotic use in late 2016, and that is now part of poultry red tractor standards. Although the pig industry hasn't ended preventative group treatments, it has reduced their use. Unfortunately, in our view, we have not seen any major change to farming systems as yet. And for this reason, certain diseases do remain very widespread. So in order to control these diseases, such as the disease coccidiosis in poultry, which is a disease which can occur very frequently when chickens ingest their chicken droppings, or post-weaning diarrhea in piglets, which can occur when the pigs are weaned too early. These diseases remain a significant problems in these intensive systems. And so the use of alternative feed additives in poultry and pigs has remained extremely high or has even increased. So in the poultry industry in particular, we've seen the use of non-medically important antibiotics called the ionophore antibiotics, which do not count in the poultry industry's data on antibiotic use because they are not used in human medicine because they are deemed to be too toxic. And as this graph shows, as the use of the medically important antibiotics has reduced, the use of these ionophores, which was already far higher and is completely routine and does not require a veterinary prescription, has actually increased. Now, there are various reasons why one might be concerned about this use of ionophores, and I won't go into the full detail, but suffice to mention that these ionophores are actually antibiotics, and some scientists believe they could be developed as medically important antibiotics in the future. They are known to be effective against human pathogens like MRSA or Clostridium difficile, and the reason they are not currently used is because of concerns about their toxicity. However, scientists are increasingly looking into whether they might be able to modify them for use in human medicines. And very recently, scientists have developed novel synthetic ionophores, which still have antibacterial activity, but have reduced toxicity to human cells. And they say that in conclusion, our study suggests the exciting prospect of optimizing polyether ionophores for use as antibiotics. Now, if this were to occur, then of course we would need to consider making ionophores prescription-only medicines in poultry, and the reliance on the use of ionophores for controlling certain widespread diseases in poultry would perhaps be limited. In the pig industry, we have extremely high use of zinc oxide at weaning time. Initially, this was going up as antibiotic use was reduced, but it has started to slightly reduce now up until 2018. However, zinc oxide is going to be banned in the European Union in June of next year because it's an environmental pollutant. There is also some evidence that it selects for antibiotic resistance, including MRSA. And it appears that the UK will be following this ban, in which case control of post-weaning diarrhea may become a problem unless there are actual systems change. And already we have heard from various people within the pig industry that there may be an increase in antibiotic use, or the alternative would be to move to a later weaning system. So could improving husbandry reduce antibiotic use even more? Well, I would first like to give a few examples from non-organic agriculture where that does seem to be the case. So some actual use data, because this is what we're really talking about today, and it is still a problem, the amount of data that we have comparing different systems. The first data is from a study published in 2016, which was a large survey of the pig industries in Belgium, France, Germany, and Sweden. Now, the pig industry in Sweden is significantly less intensive. They have a later weaning age than in the rest of Europe and than in the UK. Their pigs cannot be kept in fully slatted systems. They must have some sort of bedding, such as straw, and they also have a lower stocking density. And what this antibiotic study found is that use in the Swedish pigs was 5 to 10 times lower than it was in Belgium, France, and Germany. But really, the largest differences were found at weaning time, when usually antibiotic use is at its highest in conventional systems. There in Sweden, it actually fell, and usage in Sweden was 15 to 30 times lower than in the 3 other countries. The scientists checked the average weaning ages on the farms in the survey, and they found that whereas in Belgium, France, and Germany, they were weaning at 23 or 24 days, in Sweden, it was at 35 days, and this was clearly linked to a much lower usage. Of course, in organic farming, you are not allowed to wean piglets until they are at least 40 days old. Now, breeds of animals that are used are also very important. The growth rate of broilers has tripled since the 1950s, and standard broilers are now slaughtered aged 32 to 40 days. But in the Netherlands, the poultry industry now uses slower growing broilers for its domestic production, and it uses these standard broilers for export. And what they have found, according to industry data, is that the slower growing broilers actually use 6 times less antibiotics, according to the latest data. The slower growing broilers are also kept with slightly lower stocking density. This is indoor production. A study in Belgium compared intensively reared veal calves with those with beef cattle, which were raised more extensively, often on pasture. And what they found was that the antibiotic use in the veal calves was essentially about 25 times higher than in the more extensively raised beef cattle. They also found far higher levels of antibiotic resistance, and they attributed this large difference to the intensive indoor conditions in which the veal calves are kept and the very high stocking density. So what about organic production? So first of all, let's just quickly talk about organic standards on antibiotic use. Antibiotic use in organic production is permitted in the UK and in Europe, but preventative use is completely banned, with the one exception if there is a surgical intervention. So individual preventative use is permitted then. The withdrawal period after antibiotic use, the meat or eggs or milk cannot be sold, as it were, for human consumption during this withdrawal period. The withdrawal period in organic production is twice the statutory withdrawal period. There are also a maximum number of treatments for an animal if it is to be sold as organic during a full year or during its life, depending on how long the life cycle is.
There's
also a
yes. 5 minutes left.
There are also treatments, certain preferred treatments. If these do not work, then conventional medicines or antibiotics must be used instead. The Soil Association has higher standards on antibiotic use because of its long-standing campaign against the misuse of antibiotics in agriculture. And in particular, it has stricter rules or even an outright ban on certain antibiotics. And it also doesn't permit the use of feeding waste milk with antibiotic residues to calves during the statutory withdrawal period. So organic standards also aim at promoting good health and welfare, and some of the most important standards which are relevant to antibiotic use include access to the outdoors, lower stocking density, use of appropriate resilient breeds, later minimum weaning ages for piglets, calves and sheep, and appropriate diets, including sufficient roughage. So we've already heard some of the results of the survey of antibiotic use of Soil Association farmers from Ed. We heard about the particularly low use in pigs and poultry, but there was quite a small sample size for those particular species. In addition, however, we do have, it's quite an old study, but a DEFRA study of antibiotic use in organic pigs and poultry, which compared it with antibiotic use in conventional systems. And much like this Soil Association survey, it found some quite enormous differences in use between the organic, where it was close to zero, and the conventional systems. Of course, antibiotic use in the conventional systems has come down since then. Very recently, we've had new antibiotic data from Denmark, where they collect usage data from every single farm in the country. And this has permitted them to compare organic use in organic pigs, free-range pigs, and indoor intensive pigs. And essentially, they found that the free-range non-organic pigs had a usage level which was about half the indoor pigs, and the organic pigs had a usage level which was about 10 times lower than the intensive production. Also, they looked at organic and non-organic dairy, and they found that most of the usage was in the adult dairy cows, and that it was about 3 times lower on the organic farms than on the non-organic. So the scientists, commenting on why antibiotic use was much lower in organic pigs, said that from our findings, it seems logical to suspect that not only strict regulations on antibiotic use, but also improved health related to conditions like being born outdoors, higher weaning age, and lower stocking density have an effect on antibiotic usage. Different conditions with respect to human supervision and possibilities for intervention could also play a role, as well as differences in treatment threshold. Both studies suggested that there could be lessons be learned for non-organic farming as well. They said that the lower level of usage in welfare label systems indicates that a significant reduction in antibiotic use in pig production would require housing and management changes or regulatory changes in the conventional indoor system. And they also suggested that actual stricter rules on antibiotic use as practiced by organic systems could be introduced to reduce use in non-organic systems. So in conclusion, antibiotic use remains significantly lower in organic farming despite the recent reductions in non-organic farming. Non-organic farming can learn from organic farming. Greater restrictions on antibiotic use, in particular no group prevention, and improvements to husbandry could deliver much lower use in non-organic farming. But organic farming itself can also still reduce its antibiotic use. Systematic collection of usage data, as done by the non-organic pig and poultry industries, would help achieve even lower use in organic farming. Thanks.
That is absolutely fantastic, Colin. Thank you so much, as usual, for your immense knowledge and thoroughness and how much you've covered there. There are some questions that have come in, and we'll probably come back to them because they're slightly more complicated ones in the panel session. So Thank you very much. And if you want to turn your camera and microphone off, I'm going to introduce now our final speaker, who is the wonderful Kristin Bash. She's chair of the Food Special Interest Group for the Faculty of Public Health. Kristin is also an honorary lecturer in public health at the University of Sheffield. And Kristin brings a really important public health perspective to this important issue. What she doesn't bring, however, is a webcam. So Kristin, we won't be able to see you, which is a great shame because you're wonderful, but we will be able to hear your voice, and you have 15 minutes, and I'll give you a time check when you've got 5 minutes left and then 1 minute left. Thank you very much.
That's brilliant, Kath. Thank you very much. Yes, sorry about the technical issues, but so as Kath introduced, I'm a public health person, right? For lack of a better way to put it, which basically means that I see population level risks and benefits to most things. And so today I'm going to bring that lens to the issue we're discussing. So antimicrobial resistance in agriculture and really the public health perspective. And I'm also going to sort of highlight reasons why we need to stress the importance of approaches that have been discussed today by Helen, Ed, and Colin prior to me joining. So let me see. I'm not able to move. Oh, wait. There we go. So, I mean, I'm just starting off with an introduction. I know that I'm sure we all know what it is. So it's teaching Granny to suck eggs a bit, but antimicrobial resistance, or I'll refer to it as AMR, it's the ability of a microbe to stop an antibiotic or an antimicrobial medicine from working. It's a natural function of evolution. So when microbes are exposed to antibiotics, any that survive, reproduce, and pass along this resistance. So the more they're exposed, the more microbes are exposed to antimicrobials, it increases the chance that they will develop resistance. So that's why a big part of what we're talking about is reducing that exposure of microbes to antimicrobials, essentially. The other thing to know is that resistance can be transferred between different pathogens. So they're very tricky little buggers, these pathogens. They've been around a lot longer than we are, and they're very good at trying to survive and to evade the tools that we have against them, which are our antibiotics. So that's what it is. Is it a problem? And we know the answer is yes. So I'm sure we're all familiar with the statistic out of the 2016 report that the 700,000 at the time annual deaths globally from antimicrobial resistance would grow to 10 million by 2050. And then there's also evidence there's a huge economic impact. So estimates at $100 trillion per year by 2050 if we don't do anything. In terms of euros, about 1.5 billion euro per year is the cost in terms of healthcare expenses and productivity losses. So this is, just to set the stage, a very important public health issue. There we go. So, I mean, Colin's gone over a good bit about the use of antibiotics in agriculture and livestock. So how does livestock agriculture in particular, the use of antimicrobials affect human health? And there are several different links, and I won't go into details about these, but essentially it can, there's the environment, there's food products, agriculture workers by direct contact. These are some of the studies out there. So essentially resistant bacteria from animals and humans transmit in both directions, potentially. So there's human contact with farm wildlife or companion animals even, right? We haven't brought those in, but they are culprits at times, or their environments. It can be through ingestion of contaminated food, either imported or locally produced, and contact with effluent waste from humans, animals, and agriculture as well. And here's a really key public health issue, right? And it's a lesson we've learned from COVID, is that microbes know how to travel. They aren't shy about doing it. So antimicrobial resistance in one part of the world will become antimicrobial resistance across the globe. So these resistant microorganisms, they don't recognize boundaries. People travel, animals travel, feed travels, and this takes it globally. So just the example of MRSA, which is seen here in the map, it was introduced in the US in 1959, and 2 years later, methicillin-resistant variant of Staphylococcus aureus. So in other words, MRSA was found in the UK 2 years after methicillin was introduced. Through the next 20 years, so in the 60s, this went through many European countries, in the 70s, throughout the world, Australia, Japan, the US, and it's now global. But of course, we have increased mobility and globalization since then. So whereas it took about 2 decades for MRSA to spread, when carbapenem-resistant Klebsiella was found. It only took 5 years to spread from the United States in 2003, where it was first identified, through Israel, the UK, Italy, Colombia through 2008. So it took 5 years instead of 20. So we're talking about a very globalized environment. It's akin to climate change in terms of where it happens is not important. It affects the globe. This is another demonstration of that. So in the red, we have the dysentery, which has resistance to streptomycin and tetracycline, among other things. In blue, we have typhoid, salmonella, that is resistant to ampicillin, streptomycin, tetracycline. And then in gray, perhaps we have Klebsiella pneumonia, which is resistant to all the beta-lactam antimicrobials, including all the carbapenems and third-generation cephalosporins, which, if you're familiar, there's a very human use. They're very important. They're sometimes considered sort of a last resort. And so this spread happens very, very quickly. And so this is the really the public health importance. But I wouldn't be a proud public health professional if I didn't talk about inequalities. So we're talking here about global inequalities, really, and because pulling the lens out pretty much as wide as we can get it. So thinking about low and middle income countries, resistance is already high, and antimicrobial resistance is projected to grow more rapidly. For example, in Indonesia, Brazil, and Russia, between 40 and 60% of their infections are already resistant, which is compared to a 17% in OECD countries. In those same countries, Indonesia, Brazil, and Russia, the growth of AMR is forecast to be 4 to 7 times faster than growth in the OECD countries before 2030. So this is truly a global issue, and the innovations and the interventions that we're developing here hopefully can be and will be rolled out to a much wider a group of countries. Another thing to consider is that these low and middle income countries, their healthcare systems are already weakened, they have constrained budgets, and it creates conditions for enormous death tolls, mainly borne by some of the most vulnerable. So again, we're looking at newborns, very young children, and the elderly. And then there's a cost. So for example, the median overall cost to treat a resistant bacterial infection in India is approximately $700, which is equivalent to 442 days of work for a rural male casual worker. So whereas it's an issue for all humans, if I can say that, not to sound dramatic, it is, but particularly there's a really strong level of inequality built into that. I think we all need to just address. Now, this seems like a strange thing to bring up. I know we're not talking about aquaculture or the next slide, but I'm raising these very quickly just to demonstrate that it's so important. The interventions that were in the organic systems and in the welfare label systems that have reduced use of antibiotics are extremely important, because what we're fighting against is an increase in the use of antimicrobials in more and more farming systems. So as an example, aquaculture, in the past 30 years, there's been more than a 400% growth in industrial aquaculture worldwide. This is expected to continue, particularly wild fish and shellfish is being touted as a very sustainable production. But how they're raised in farms involves a lot of crowding, often poor sanitation, which reduces the immune levels in the fish, and bacteria outbreaks are common. So then that presses an increased demand for prophylactic antibiotic use for the fish, which leads to increase of antibiotic resistance of the bacteria in the environment. So increased antibiotic resistance in fifth pathogens undermines the effective prophylactic use of antibiotics, sets up more. So this whole pattern sets up routes for passage of these antibiotic resistant bacteria into the environment, and a transfer of their antibiotic resistant determinants to the bacteria of land animals and human beings, including pathogens. So put simply, as the antibiotic resistance develops in these fish, it spreads into the environment and then transfers over back to pathogens that affect land animals and ultimately humans. So it's a growing problem. Then we also have an issue with, and it is not at the level of livestock, but it's something to be aware of. This is in my country of origin, the US, and this is a disease known as citrus greening. It's quite devastating actually to farms. These are farms that have been in families for generations, and it's wiping out citrus crops, so it's quite tragic. However, as a remedy for this, that's actually not proven to work, but the EPA has proposed allowing as much as 650,000 pounds of streptomycin to be sprayed on citrus crops every year. And just to compare, American humans actually only use 14,000 pounds of the aminoglycosides, which is the class of antibiotics that includes streptomycin. So 14,000 pounds for humans, 650,000 pounds for citrus. And as we probably all know on this call, or maybe many of us do, streptomycin is a very important antibiotic. It's especially useful in urinary tract infections caused by E. coli and other gram-negative bacterial infections, types of pneumonia and meningitis. So it's quite shocking that we're risking that, and it's a growing issue. So what is the public health approach? I don't know what that number 56 is. It's snuck into my thing. But the public health approach, right?
Kristen, just say that you've got 5 minutes left.
Fantastic. That will be perfect, actually, Kath. Thank you. So some possible interventions we can look at. I'm calling them supply and demand, just a few little quick economic terms. So looking at voluntary changes and adaptation of farming methods, and this is also very much related to what we talked about here today. So all of the different modifications that are made in both organic systems, welfare label systems, and the reduction in antibiotic use by farmers, as well as some that are brought around by regulations and enforcement. There are also some veterinary interventions. So I know we have quite a lot of veterinary students and vets on the call. So yeah, the study I'm about to show does suggest that there's some fees involved to vets, and we'll go through that. And the demand side changes, so population level dietary shifts. So the initiative today is an example of that voluntary push. In the EU, regulations have really been at the forefront of reducing use of antimicrobials. So that's how that's pushed forward. Colin has outlined some of the other ways that that's happened. And then, as I just said, the veterinary drug users could be charged a fee for sales of antimicrobials, right? I know the least about this option, just to be fair, but I think it's being introduced on the same principle as charging, to put it in the most basic terms, for the plastic bags at the grocery store. So keeping in mind that this is looking at a global footprint with the issue, but it's meant to reduce the use to need only. Demand side changes in the US consumer demand has been a somewhat, I say somewhat, I use that cautiously, effective measure to reduce use because consumers don't like to see it on the label. And in China, they've recently reduced the level of meat intake to 40 to 70 grams, which is about half of what the benchmark consumption levels were before. So this is some of the, this is all against business as usual. And as we know from what Colin said, this is actually one of the same studies he's referenced, is that there's expected to be a 50% increase by 2030. So that's that top level, and this is what the reduction would be with each of these interventions. And you can see there's a there's different meat consumption per capitas. There's a limit. These are regulations. But to me, the most interesting thing is if you start stacking them together, right? So if you look at a global regulation putting a cap of 50 milligrams of antimicrobials, which is the current global average amount, that could reduce, so if we kept it there, it could reduce total consumption by 64%. If we limited meat intake to 40 grams a day, which is quite stark, that would reduce it to about 66%, but a more realistic or a more moderate cap of 165 grams of meat, which is the projected EU average for 2030. And if you start stacking these on top of each other, including a user fee, again, I know the least about that, but all three together could reduce the use of antimicrobials by 80%. Now, those regulations, as I'm listening to the speakers, it could be regulation, it could be voluntary or switching over to different systems that use less. That's basically just reductions at the point of use. So it's just demonstrating that there are ways to overlap innovations and interventions to reduce the global level of antimicrobial use in livestock. And finally, I was asked to discuss this. I am keeping this quite brief, not least of which because I don't have much time left, but the One Health approach, probably with the number of vets on the call, you're familiar with this. My diagram got cut wonky here. But since AMR, we know, is found in bacteria from humans and animals, it's a problem that can't be solved by looking at either in isolation. So the One Health approach recognizes the relationship between health and disease at both the human, animal, and environmental interfaces. And it's become a focus for both medical, veterinary science. There's a whole society treatment of health hazards, and it's being used as an influence in a way to track things through policy. It's driving research, and it's a way to see it. It's really a systems approach to antimicrobial resistance and not just signaling out a single issue. It's linking them together and acknowledging that it all works together in terms of what's important in reducing antimicrobial resistance. And that's it for me. Thank you.
That is absolutely brilliant. What a fantastic whistle-stop tour of the reasons why we're all doing this. I'm going to invite all of the panelists to come back onto the screen, and we're going to have a question and answer session now. So if you want to turn your camera and your microphone on and join us, that would be fantastic. Thank you. And I'm going to look down, we've been sorting questions behind the scenes, and I think there's a set of them, and especially given the large number of vets and veterinary students in the audience, there's a set of questions which are about the veterinary profession, actually. So let me ask the general question on behalf of Lisa Morgans, which is how can vets do more to reduce antibiotic use? But also specifically to Ed, and I might ask you to start, is did you find any evidence that vets were an important factor in the level of antibiotics use? And the more general thought for everyone is, what is the role of vets within this? If you want to answer a question, panelists, you can put your hand up to me, apart from Kristin, so just shout out, Kristin, if you'd like to. But I'll come to Ed first.
Well, yeah, I guess the role of vets is to maximize the level of welfare of animals under their care, and also to try and help their farming clients as best as possible. And there's a real challenge there, because there's a slight conflict of interest in that you are advising the usage of medication and indeed profiting from sale of medication at the same time as advising on how best to minimize the requirement for those medications. And so I suspect that, as in many walks of life, we see a huge spectrum. And as I alluded to in my talk, there have been larger studies which have shown that the prescribing veterinary practice is a significant influencing factor in the level of antibiotic used on farm. Now, our sample size was really too small to make those sorts of conclusions. We had lots and lots of different veterinary practices who perhaps might only have looked after 1 or 2 farms within our sample, and some who may have been looking after 10 or 15. So very difficult to infer from our particular survey whether an individual vet or an individual practice had a strong influence in the level of usage on farm. But certainly the feedback from high and low users was that their personal vet, their individual vet, and probably more so than their practice, was the go-to person for advice on health and welfare, and they really trusted that person. So the attitude of that person is going to have a bigger influence probably on the attitudes to medicine usage of the farmer than any other single factor.
That's really helpful. Thank you, Ed. Helen, do you want to come in?
Yeah, just to add one point to that, I completely agree with that. But I think that as farmers, the one thing the plea I'd make to farmers is that given how much we value our vets and our vets advise how much we depend on that, we should be being prepared to pay for advice. And I think there's often a reluctance in the farming community to actually look at involving their vets early enough in all the planning that we're doing, and actually being up for paying for that advice rather than just thinking they have to slip it into the drugs cost. So I think it's a two-way shift we need to see, I think. And the vets understanding the farmer's motivation and getting on board with that and really helping us learn together is key. But as farmers, we've got to make sure that the vested interest that Ed explained about, so many vet practices are dependent on the revenue from drug sales, as it were. We can only get off that if we actually really value and pay for that advice in itself.
That's really helpful. Thank you, especially from a practitioner farmer perspective. Colin, did you want to say something about the role of vets as well?
Well, I mainly just to say that I completely agree with the points that have been made so far. I would add that in the Netherlands, they have been doing benchmarking for quite a number of years, and they've been collecting data on antibiotics from every single farm, but they've also been benchmarking the vets. And Now, I don't know what the more recent data on the vets is, but certainly when they first started doing this, they found very large spreads, just as we found in the organic system, you know, that there are differences in usage at the farm level. They found big differences in usage at the farm level in the non-organic system, but they also found big differences in how many antibiotics different veterinary practices were prescribing. Now, of course, this may be because certain veterinary practices had certain farms that had particular problems, but clearly it's probably not just that. It's probably also linked to the vet's approach to antibiotic prescribing. So clearly, everything that our survey and other surveys asking about the importance of vets and from the point of view of the farmer, it seems that they are really key.
That's
and
really
on those Dutch on that Dutch work as well. There's a very interesting study, I thought, which was looking at the willingness to change, and that the vets and the farmers were interviewed separately, and actually farmers are often a lot more willing to change than their vets give them credit for. It was shown quite often that vets would make assumptions about farmers' attitudes to change, and that if anything, it was the vets that were a little bit more suspicious. And we've seen that a little bit with the PWAB stuff as well. Quite a lot of farmers, you know, they tend to be very pragmatic. They say, "Oh, if that's what they want, then we'll change whatever we have to do to make that happen." Whereas the instinctive reaction of vets has more been, "Oh, that's a bit different. We haven't got any data to prove that. We're concerned about the welfare of animals under our care." And so possibly slightly more resistant to change than the farmers.
And we do have a question relating to that. Let me just find it, because I remember it from Lindsay Wistance, who I believe is from the Organic Research Centre. And she was asking that this approach, and I'll perhaps Lindsay might want to come back on it in the questions box, but I'm not quite sure what you mean by this approach, because I think there's a lot of different approaches being discussed here. But the question is that whilst concentrating the mind on reducing antibiotics may be failing the cows that do require help. And that might not sit so well with organic principles, maybe, when it's to do with animal welfare, including the sort of care principle. And that might make it difficult in organic farming when appropriate treatment means a loss of that animal to the system. So I wonder if you might have some thoughts on that, and I'll perhaps direct that to Colin and Helen. And I'll be coming to Kristin later with some public health type thoughts as well.
Yeah, I mean, so first of all, generally, organic standards do say that if other kinds of treatments are not working, that you must use, you know, conventional medicines, including antibiotics. And so a farmer that was refusing to use antibiotics on an animal that needed antibiotics, that goes against certification. Regarding PWAB, that's slightly different, because that's essentially an organic certification for exporting, say, to the United States, where they don't allow antibiotic use in farm animals, whereas in Europe we do. But even there, I mean, essentially the system is that if you do use the antibiotic, then you will no longer be able to sell it under that PWAB contract. But, you know, in theory, you can still sell it as organic milk in the UK, or just as non-organic milk. It doesn't mean that the animal won't get the treatment that is needed. I think what the survey of the farmers carried out by Ed seems to have found, however, is that quite a lot of people converting to the PWAB have really found that they could really reduce their antibiotic use without having these welfare issues.
And there's a further question which is to do with these things, which is from Aled Davis from Fruex. He says, is there a way to measure mortality and antibiotic usage and analyse this? And he's saying that on a webinar with our local vets last week, farmers were encouraged to cull dairy cows where there was chronic mastitis cows, as opposed to treating them often. And this was seen as a way to reduce antibiotic use per farm. Should we insist on prudent antibiotic use being aligned to mortality rates? Do anybody have an opinion on that they'd like to share?
Yes.
Well,
The expectation from antibiotic use is frequently unrealistic. So, for example, a cow with recurrent cases of mastitis is unlikely to respond to further mastitis treatments. You know, some models would suggest cure rates in the single figures on those sorts of cows, and they can in fact be a reservoir of infection, which is then possibly a threat to the healthy remaining members of the population. Yes, we can measure culling, and we will measure culling as part of the annual data collection process for the Soil Association. It's slightly complicated by bovine TB because that can falsely raise culling rates. So we need to be quite careful with how we analyze the replacement rate information. But yes, obviously it is unsustainable just to kill every animal that gets sick. However, that is not a realistic representation of what is happening. The self-cure rate in a healthy population with low levels of disease is actually very high, and the success of antibiotic treatment of chronically infected individuals is very poor. So a small population of the herd or flock can represent a very large contribution to the overall level of antibiotic use. And prudent use is knowing as much when not to use antibiotic as when to use antibiotic.
Thank you, that's really helpful. I've got some questions also which are relating to husbandry and systems seems to be a really important word in all of this, you know, looking at the whole piece, including in the One Health approach. So a question here saying, how can we encourage slower growing and lower stocking rate systems across farming, brackets, pigs, cattle, sheep and poultry? What would be factors that would help in encouraging those slower growing and lower stocking rates? Helen,
Well, I guess, well, I'll go, but I mean, I guess we need to make it a sensible business option for farmers to go down that route. So you either use regulation as the driver, where you force people down that route, and then you need to make sure they're not protected, they're protected from being undermined by imports that aren't meeting those standards. Or we need the market to be requiring that of them, whether that's through brands, retailers, or consumer labels. Or we need to be able to demonstrate that those systems actually make financial sense in themselves because mortality is lower and the performance overall is better. So I think we need to kind of have that evidence base and those drivers to help farmers get off the sort of treadmill, not just with antibiotics actually, but with a lot of other inputs that we're using in agriculture that may not be that helpful.
And that seems to bring in quite a lot of factors around the economics of it, the marketing, the the regulation. And I wonder if anybody has an opinion on what should be happening next with that, because we've got something from James West from Compassion in World Farming saying, so I'll read out what he says. We've heard about reduction in antibiotic use in some sectors. Is it possible to further reduce antibiotic use within intensive indoor farming systems within those sectors? Or have we reached the extent to which antibiotics can be reduced there, and a shift to higher welfare, organic, free-range, extensive farming is now the main or only way to further reduce in the farming industry? What are your thoughts on that?
Well, my thoughts is that if you introduced stricter rules on farm antibiotic use without looking at welfare or husbandry, you could reduce antibiotic use further, because we know that's the case. For instance, use in pigs in the Netherlands and Denmark. So these are two industries that are very intensive, but their antibiotic use is about 2.5 times lower than in the UK, despite the large reductions that have already occurred in the UK pig industry. And a major reason for that is that kind of preventative mass medication is not permitted. There are stricter rules on antibiotic use. On the other hand, an even less if you look at Sweden, which has a less intensive pig industry, its use per pig is 9 times lower than the UK. You know, the organic use in Denmark is 10 times lower than the non-organic use, which would suggest that it's, you know, approximately 25 times lower than the UK use. So you're going to get certainly much larger reductions potentially through improvements in husbandry and shifts to more free range or type systems or higher welfare systems. But particularly, I would say in pigs, or even in cattle and sheep, where there has yet to be the same level of effort, because the antibiotic use started off at a lower level. There has yet to be the same effort in the UK to reduce that use. I think, you know, there is still room for reductions, yes, but they are clearly slowing already. Yeah.
And I hope that will answer Reinhild Benning's question about some of the differences between countries and why those differences exist. There's a very specific one that's come in from Catherine Jadav, which is the difference in antibiotic use in Dutch poultry, is the difference in antibiotic use in Dutch poultry based on preventive group usage or targeted use based on the presence of disease, or perhaps both? Do you know that?
Well, so purely preventative group treatments are not permitted in farm animals in the Netherlands anymore. That's sort of been the case now for nearly 10 years. That doesn't mean that there aren't group treatments, because essentially in poultry all antibiotic use is group treatments. You know, when it happens, you can't go around individually injecting a chicken. That's not really feasible. So there have been reductions overall in Dutch poultry, but the differences that I referred to in my presentation were between the fast-growing animals and the slow-growing animals, and they are essentially raised under the same rules regarding antibiotic use. So it's really the differences in the genetics, the resilience of the breeds, and also the slightly lower stocking density that is used for the slower-growing birds.
That's fantastic, thank you. A mine of information as ever. I want to come, because I want to have Kristen's voice here. Your invisibility from the webcam shouldn't also be invisibility of your voice, because you are so important in all of this. And I think that there's a few questions here, which is about the whole behavioural change kind of question. And obviously the behavioural change is largely motivated by public health. So Gareth Morgan from the Solid Association has asked that Ed has made an interesting comparison with COVID communications, but he focused on the personal and economic issues for farmers. Is there also a role for communication about the wider public health issues at stake here? And how can farmers make a contribution to the wider battle against AMR? And I wonder, Kristen, if you might like to reflect on that.
Yes, well, I was quite pleased to see the behavior change model make an appearance, because that's very much public health bread and butter, understanding the risks, understanding the barriers, and everything that Ed went through. And the parallels with COVID are exactly right. So it's about how people take action. So I think what we're talking about here is two different. So we have, going back to my model, so you've got consumer action, you've got the sort of the demand side, and then you have production side. So there's some evidence in the US, for example, that a certain slice of consumers are very keen to have antibiotic-free products. And so getting them to understand the risks, I think it tends to be a more affluent population group that's very interested in the environment and wider issues and social justice issues that take those things up. Now, if we can bring that message through and put them at a cost point where a wider group of people can afford them. And so that's the issue, isn't it? In terms of a consumer side, if you're talking about higher welfare standard, it's the less and better argument. In terms of farmers and what they can do, I think I need to turn that over to the farmers. I'm very much a co-production person. So I'm not sure, other than, I think it's going to come down to policy and making higher standard products, higher standard raised chickens and cows and pigs available at a price point that people can afford, and then educating people why that's important. with that same model. It's difficult because it comes, sorry, I know I'm wafting a little bit, but it comes down to the same arguments around people making decisions for climate change, right? So it's a risk that's far away, and it's very difficult to have people from a consumer's point of view understand why that's a risk to them personally. And that is a challenge that we have in public health, but it's not one that's insurmountable. And I think we need to make a better job of doing it. So I hope that answers the question a little bit, Kath.
I think that's very helpful, because obviously the whole climate issue is hanging around us at the same time, and obviously there's a massive livestock question in there as well. And you alluded to the less and better meat and dairy consumption. That several members of our alliance are also members of the Eating Better Alliance, which is about just that, looking at what would better livestock production be that would answer all of these questions to do with AMR, to do with climate change, to do with the restoration of nature as well. So I am realizing that we're coming to the end of our time together. As everybody has ably demonstrated, this is an area rich in opportunities for discussion, for research, but also for action on something that really does concern us all, as Kristin said. And I will take away from this presentation very much your slide on the inequalities in the impact of AMR around the world, because this is a global issue, and a lot of British farmers are already doing a great deal to reduce antibiotics. But of course, we're now entering into a world of international trade where we may inadvertently or advertently start encouraging poor antibiotic use in other countries as well by, favouring that kind of produce in trade deals. So this is a very live issue. It's very, very concerning for everybody. And I just wanted to finish by saying thank you so much to everybody who's attended. Please do keep in touch with us. As I mentioned at the beginning, we want this to be an ongoing conversation. And once you leave today's webinar, you'll receive a survey on the presentations, and we'd appreciate it if you could complete that and provide your feedback. And you'll also receive a follow-up email in the next day or so with a link to view a recording of today's webinar. And that will also have details of how to stay in touch with everyone. So once again, I encourage you to keep this conversation going. And my final job is to say, on behalf of the Alliance to Save Our Antibiotics and our presenters, thank you for joining us today, and we hope you enjoy the rest of your day. Thank you very much indeed.